Hi, and welcome to my podcast, the Fertility, Motherhood, and Wellness Show, True Stories with Dr. Rajeev. Through this podcast, I will be dealing with issues related to fertility, safe motherhood practices, as well as women's health. It was 6 p.m. when she called me saying her baby hasn't been moving since morning. I asked her to rush to the hospital to get an NST done. I don't know if it was my sixth sense working, but I decided to leave for the hospital myself and also informed the hospital to keep the ultrasound department on standby for an emergency scan and the operation theatre for surgery. As she reached the hospital and tests were done, we found that the baby indeed was in trouble. We decided to operate right then. The baby was delivered in no time, and luckily so, as the baby was in severe distress. The pediatrician said that if the delay had been for even maybe a half an hour more, we might have lost the baby. We managed to save the day, though I wish the mother had raised the alarm a little earlier. The couple decided to name the child a miracle child in their language, and rightfully so. Her survival was nothing short of a miracle. A mother's joy begins when new life is stirring inside, when a heartbeat is heard for the first time, and a playful kick reminds her that she is never alone. There is truly no better feeling than the movement of life inside you. While it helps you connect and bond with your unborn child, it is also a sign that all is well with your baby. However, sometimes for a variety of reasons, you may not feel the movements, and then panic sets in. Studies have shown that at least 40% of all pregnant women and 80% of women in their last 3 months of pregnancy will be concerned about less fetal movements at least once. You need to rest assured that in 70% of such cases of a single episode of less movements, there are no complications. What do all these baby movements indicate? When do they start happening? When does a mother start to perceive the movements? And do you need to record the movements? And how do you do it, if at all? Well, to answer all these doubts is why I'm here with this podcast on fetal movement count. How, when, and why. So keep listening. So what is normal fetal movement, or when does it happen? Sonographically, that is by ultrasound, fetal activity can be recorded as early as 7 to 8 weeks of pregnancy. However, maternal perception of fetal movement typically begins in the second trimester, at about 4 to 5 months of pregnancy. Earlier in women who've had a previous child as compared to women who are pregnant for the first time. The mother's first perception of fetal movement, termed quickening in the medical parlance, is often described as a gentle flutter. In the second and third trimester, sonography reveals a wide range of movements like bending, hiccups, breathing, rotation or stretching of limbs, moving the hand to the face, opening and closing of hands, head rotation, sucking, yawning or tongue protrusion. When these movements are seen on ultrasound and are correlated with maternal perception, that is, mother feeling those movements, only 50 to 80% of all the movements are actually perceived. You won't feel those, small movements such as thumb sucking or stretching of fingers and toes, but you will feel the baby's arms and the legs moving or kicking, and other movements such as rolling or even hiccups. Let me enumerate some important points that you must know. Every baby is unique, and it is important for you to get to know your baby's movement patterns. Fetal movement increases throughout the day, with peak activity late at night, which is why mothers complain that when I go to sleep, my baby wakes up. As your baby grows, both the number and type of movements will change with your baby's activity pattern. During both day and night, your baby has sleep periods that mostly last between 20 to 40 minutes and are rarely longer than 90 minutes. your baby will usually not move during these sleep periods. The number of movements tend to increase until 32 weeks of pregnancy and then stay about the same, although the type of movement may change as you get nearer to your due date. Often, if you're busy, you may not notice all these movements. Importantly, you should continue to feel your baby move right up to your time you go into labor. And your baby should move during labor too. So what do these movements represent, and why do we hold these movements so important? The various movements that a baby undergoes, the tone of the limbs that the baby exhibits, and other movements like the breathing movements that are seen on ultrasound are a result of complex coordination between various body systems in the baby. Their presence tells us that all is well in the baby's environment. When these regulatory systems are subjected to oxygen deprivation, the baby gives a signal to us by decreasing the fetal movements. There are some other features or signals which can be seen only on an ultrasound and on devices like the NST or non-stress test machine. I will talk about this a little later. This happens possibly because of redistribution of blood and nutrition to the various essential organs during crisis. If the oxygen deprivation becomes more severe, the compensatory mechanisms may fail to protect the baby. There is a saying that mother always knows. Hence, perception of appreciating baby movements is above all other tests. That is the reason why we gynecologists never ignore when a mother says that her baby is moving less than before. Here is the answer to the question that all of you have been waiting for. Oh, but I haven't even asked the question yet. So, the question is, do pregnant women need to keep a fetal movement count? And if yes, then how? And from when? And what is the minimum number of times the baby must move per day? The answer is a simple no. There is no need to specifically count the number of times the baby moves every day. There is no specific number of movements that is considered normal. During your pregnancy, you need to be aware of your baby's individual pattern of movements. You make sort of a mental note of how your baby has been moving over the past days or weeks and compare the movements of each day against that. A reduction or a change in your baby's movements is what is important. So let's say, for example, you would be experiencing about 20 movements a day, and today you are experiencing 45. Or in the reverse situation, you would normally perceive, say, about 35 movements, and today you can feel only 15. All of them, or rather both of them, are abnormal. Having said that, there are some women in the high-risk category that need to be more careful than others. These are women who have diabetes or blood pressure in pregnancy, are above the age of 35, those who smoke, have been told that the placenta is supplying less blood to the baby, or the baby is slow in growth, what we call as IUGR or intrauterine growth retardation. Women who are obese, because of the fact they can't feel the baby's movement, or who have a prior history of babies with poor growth, or a woman who unfortunately lost her baby in late pregnancy. And lastly, women who undergo IVF are also placed in the high-risk category and need to be more careful with baby movements. Even though textbook teaching says that this special category of women also don't need to keep specific baby movement counts, in my practice, I definitely advise them to. Here's how you do it. Babies tend to move more after you've just had a meal. So for 1 hour after breakfast, lunch and dinner, lie down on your back, turn to your left side, place your right hand over your belly, and count the number of times you feel the movements. I will repeat once again. So for 1 hour after breakfast, lunch and dinner, lie down on your back, turn to your left side, place your right hand over your belly, and count the number of times you feel the movements. record the values on a piece of paper and total at the end of each day. So for example, if the movements were 5 in the morning, 5 after lunch, and 4 after dinner, then the total count becomes 14. Do this every day after 30 weeks of pregnancy or as directed by your doctor. Sometimes, even if there are no problems, some women in some situations may perceive less movements. It is important for you to know them so that you don't panic unnecessarily. You are less likely to be aware of your baby movements when you are active or busy, which is why sometimes working women during the office hours don't perceive baby movements too well. If your placenta is at the front of the uterus or the womb, it may not be easy for you to feel the baby's movements. If your baby's back is lying at the front of the uterus, you may feel fewer movements than if his or her back is lying alongside your own back, because in the latter situation, you can feel the kicks in front. If your BMI or body mass index or weight-height ratio is more than what is considered normal, again because of the increased fat in the abdominal wall, you may not be able to perceive movements. If you are early in your pregnancy, then it's normal not to perceive movements. If there is abnormally high fluid or liquor around the baby, again the baby movements may not get transmitted to your abdominal wall and you may not be able to feel them. Lastly, your position may affect how you feel baby movements. If sitting or standing, you will feel them lesser as compared to when you are lying down, which is why I said when you have to count the baby movements, you have to lie down and count. The movements may also be less if the baby is sleeping. I told you earlier that babies do go through sleep cycles. If you're taking any sedatives or strong painkillers, these can get into your circulation and cause less movements. Alcohol and smoking may also affect your baby movements. So when is it that you should panic or seek help of your doctor? As I said earlier, your perception of your baby's movement is most important. If you feel your baby's movements are much lesser or much more than usual, or the movements have been absent for much longer than they usually are, then you must kick in what I call as the FINS protocol, F-I-N-S, FINS protocol. Do not use handheld Dopplers or phone apps to check the baby's heartbeat, because the heartbeat being present does not guarantee that the baby is safe or will be safe later. F stands for fetal movement count. So stop all activity, lie down for 2 hours on your left side, and with your hand on your tummy, observe how many times the baby moves. It should be a minimum of 10 in 2 hours. If yes, that is, the baby has moved a minimum of 10 in 2 hours, then it's normal and go back to your normal daily routine, but just keep a close watch. If no, then move on to I of FINS. So FINS was F-I-N-S, so the second letter is I. I stands for inform your doctor. If it's daytime, he will advise you to go for the next 2 letters in FINS, that is N for NST and S for scan or sonography. If it's nighttime, skip the I for inform your doctor and go directly to the hospital where you are booked for delivery. They will perform the NST and inform your doctor themselves. Remember, there will be plenty of false alarms in pregnancy for various reasons. The only way to ensure safety is to act upon each and every alarm and follow the protocol set by your doctor till everyone is sure both mother and baby are safe. So I spoke about N for NST. So NST, for those of you who don't know, is non-stress test wherein a belt is wrapped around your belly and the baby's heart is heard and recorded on a piece of paper. It's like an ECG of the baby's heart. The pattern that the heart makes on that piece of paper tells us if the baby is doing all right or is in some distress. The nurse will also ask you to record any movements that you may feel while the tracing is being taken. It is carried out for about 20 minutes. It might be done for longer if the nurse or doctor on duty is not satisfied with the tracings. If the tracing is perfect, you will be asked to go home and get an ultrasound done soon. If, however, the tracings are not good, you should proceed to get a scan or an ultrasound done. While the NST tells us how the baby is doing at that point, the reason for the less fetal movements are not understood from it. For that, you need to get an ultrasound scan done. The scan will pick up the water around the baby and the blood flow through the placenta as well as the baby's brains. These are some very meaningful informations that tell us a lot about the baby's health. Studies have shown that across the world, 60% of women wait for 24 hours or more before seeking help when faced with less fetal movements. This, despite the fact that raising the alarm at the right time can reduce very, very serious complications concerning the baby by 30%. Now that you have this podcast, you can't say the information wasn't available to you, right? So educate yourself. Don't work yourself up with issues related to baby's movement counts. Be aware, be alert, and don't be lazy in raising the alarm when you feel there is a problem. Remember, you as a mother know best. So my friends, this brings me to the end of yet another podcast episode. I hope you enjoyed listening to it as much as I enjoyed making it. If you get a chance, do look up my website www.drrajeevagarwal.co.in and the associated blog. I also have a YouTube channel in my name. Do email me on fertilitywithoutborders@gmail.com if you have any queries. You can follow me on Instagram for regular updates on women's health related issues. My Instagram handle is Doc Rajeev Agarwal. That's DOCRAJEEVAGARWAL. This podcast is available on Apple and Google Podcast as well as Spotify. Do subscribe and leave your comments and suggestions for any future topics on the Apple Podcast app. That's the only way we can make this better. Looking forward to great interactions. Keep listening.